Flowers while you're living, flowers while you're living, flowers while you're living, flowers while you're living, living, flowers while you're living, flowers while you're living, flowers while you're living, living. You don't need to wait till you're underground. You need to receive them here and now. Flowers while you're living, flowers while you're living, flowers. Hello and welcome to Flowers While You're Living. I'm your host, Cheryl Thomas. And today we have a special guest for you. And she is the practice manager for Kettering Health Years Ahead. Her name is Kayla Holloway. Welcome, Kayla. How are you?
I'm doing well. Thank you. Thank you so much for having me today.
Yes. Okay. I've never heard of Years Ahead, so can you kind of explain to us what it is?
Absolutely. So Years Ahead is senior-focused primary care. So we see patients that are 65 and older, and we're their primary care provider. Our focus is on maintaining the health for seniors and connecting them with the resources they need to maintain a healthy lifestyle, because we realize that health is more than medication. So as a part of what we do, we manage chronic health conditions, we offer education, fitness classes, and we connect patients with other resources as far as if they need assistance with medications, transportation, things like that.
Okay. Now, where are you located?
So we have 3 locations. We have a location in Centerville, one in Kettering, and then the newest location, which I'm the practice manager of, is in Dayton on Salem Avenue.
Okay. So who can participate in this?
So any seniors that are looking for a primary care provider can come to the Years Ahead locations, any of the 3, to see primary care. And then also the programs that we offer are open to seniors in the community. So even if they're not a patient, they are not in need of a primary care provider, the seniors in the community are welcome to join in the programming that we offer.
Okay. So how does Years Ahead primary care stand apart from the others?
That's a great question. So at Years Ahead, the providers have less patients. We have longer appointment times, so the providers have more time to come up with a patient-focused care plan and really get to know our patients on an individual basis. We only see seniors, so we're in tune with senior needs and the things that are important to seniors.
Mm-hmm. Okay, so how do they get in touch with you? I mean, because like I say, I have never heard of Years Ahead. So how do people get in touch with you?
Yeah, absolutely. So if they visit ketteringhealth.org and the Years Ahead landing page, you can find the phone number to reach out to any of our 3 locations. And anyone, if you call the location, they'd be happy to answer any questions you may have, get you scheduled for a new patient appointment, give you information about the upcoming programs that we have to offer.
Okay, well, now explain about the care plan. What do you do with the care plan? How does that work?
Yeah, so the care plan is really something that the providers work with the patients on a one-on-one basis, because it's individualized based on the patient's particular conditions and their needs. So it's really something that the provider and the patient work one-on-one. And like I was just saying before, we understand that care is more than medication, so it's really a holistic approach. Some of the programs we offer include fitness classes, so maybe the provider will include that in the patient's care plan.
Okay, so actually what you're doing is like doing a plan, and with the patient you're writing it out and say, hey, this is what we need to do to help you other than the medication, stuff like that. Like you say, exercise, eating right, and things like that to kind of help a person along, correct?
Absolutely. It's a collaborative effort. So the patient and the provider will set goals and then make a plan to reach those goals.
What is your approach to seniors? Say I'm a person that's interested in the Years Ahead. How do you approach me, or how do I approach you?
Yeah, so there's two ways you can be involved with the years ahead. If you are looking for a family doctor and you want to see one of the providers that we have at any of our locations, then you could reach out to that location specifically and schedule an appointment with the provider. But also the programs, so as far as the education and the fitness classes that we host at our facilities, those are open to seniors in the community. So we invite and encourage anyone in the community to partake in those programs and get education on diabetes management, preventative screenings for cancers like colon cancer, breast cancer, and come and enjoy some fun fitness classes like Tai Chi or yoga, and we have Zumba sometimes.
Okay, that sounds interesting. So if I was interested in doing some of that stuff, like you say, Tai Chi and all that, you have classes at the places, the locations, and then I would come in to do the exercise or whatever else it is.
Yeah, the full schedule is available at ketteringhealth.org/events, and you can register for the classes there. Most of the classes are at no cost to the participants. Some have a small fee associated with them, but we just ask that everyone register, and you can do that online, or there's also a phone number listed on the website to register for those classes, and then just come in on the scheduled date and enjoy the program.
Okay. So Kettering Health is dedicated to addressing the diverse needs of seniors by offering health services and programs, correct?
Absolutely, and we understand that everyone is an individual. So that's our goal, is to get to know our patients and what their specific needs are, and then just fill in the gaps and help them to be on the road to having a healthy, happy life.
Okay, all right. So now, what are some of your up and coming events that you're going to have coming up?
Yes, we are heading into the holiday season, or we're already here. It's coming upon us so fast. So we do have a series, educational presentation about making healthy choices throughout the holiday season, because that can be difficult. And then also moving into the winter months, we'll have some virtual presentations available as well that seniors can participate in.
Okay, now when you say virtual, that's online.
Yes.
Okay, so how do they go about doing that?
The same website, ketteringhealth.org/events. It will have the directions for joining those virtual events, as well as the link to register for those.
Okay, now those are events. Now what about classes that Years Ahead have? What kind of classes do they have?
Yeah, so sometimes some of the programming is a one-time event, a one-time presentation, and there's also a series. We're kind of wrapping up right now, a balance series that kind of goes over, is about 6 to 8 weeks long, goes over lots of things. Exercises to strengthen your core and help you with balance and prevent falls, and education about, ambulatory aids if you need them, and just the wealth of resources that a lot of people don't know are out there. So that's another added benefit of these presentations. We have community resources coming in and sharing what is available for our seniors.
So now if a senior needs to get x-rays and lab work and things like that, how do they go about getting that done?
Yeah, so if they have an order for their provider, our locations do offer imaging and lab services, but another added benefit to being a part of this big organization that's Kettering Health is you could have your labs or imaging done at any of the facilities, not just the Kettering Health, the Years Ahead locations, but any of the hospitals or freestanding imaging or labs that Kettering Health offers.
Oh, okay. So now, do you help people with internal medicine? With the primary health care for 65 and older?
Yeah, so that's what our providers are. They're specializing in family medicine, primary care, internal medicine. So they'll be your family doctor, just specializing in only seeing seniors that are 65 and older.
Okay. So is there anything else you would like to maybe tell the public about Years Ahead that we should know?
Well, I am just very proud of what we do at Years Ahead. We really do have a large care team that focuses on and takes into account all aspects of healthcare. our pharmacy team that helps find ways to lower the cost of some of those expensive medications. And as you may know, diabetes medications can be really expensive. So our pharmacy team works to find options that can sometimes get those medications at a $0 cost to patients. We have social workers on our team that work to connect patients with transportation needs and other resources in the community, housing, if people are making the transition from independent living to assisted living and they need assistance in getting information about that. We have case managers. When you're in the hospital or in the emergency room, we call you after your discharge and make sure you understand your instructions.
Right.
So we're really there with you every step of the way to answer any questions and just make sure that you stay connected to the hub, which is your primary care provider, and that your needs aren't going unmet, and that you have the resources and the knowledge that you need to be able to manage your health.
Right, okay, because it sounds like people can be clueless on what to do, whether going to the doctor, to the hospital, to get exams, lab work and things like that. And you, like you say, you just kind of help them along the way to, you know, whatever it is that they need to know, kind of make a person feel a little secure about it. Okay, I'm comfortable with this. Yeah.
And sometimes you don't know what you don't know.
Right, exactly.
So yes, we're definitely there to simplify healthcare, because we know that it can be scary sometimes when you have a new diagnosis. That when you do have a new diagnosis, there's all these things to think about. Well, do I need to change my diet? And what's this new medication that I'm taking? So we just want to make it as simple as possible so that there's not that barrier or that confusion around medicine that we know has been there sometimes in the past.
Right. Well, not only that, you mentioned about assisted living and things like that. Because a person that's been living on their own for so long, and then they need to go into assisted living and stuff, you kind of help them transition into that.
Yeah, that is a huge step to take, and there's a lot of things to take into account. And with us being focused on seniors, there's some things that are unique to seniors, like making that transition, and working with advanced directives. Sometimes, you know, you come to a point where you maybe want to think about power of attorney for healthcare. And our social workers can help you understand that and make sure that you have all the documents in order that you need in order to move forward with things like that. Another service line that we do offer is we have a counselor on site at our Years Ahead clinics that does therapy. So as you know, in addition to your body, we're taking care of your mind and
as
your
well.
spirit as well.
Right, because a lot of people are lonely, and a lot of people need somebody to talk to. And I guess with your services and then having a counselor, things like that, they can try to, you know, just help a person.
Absolutely. And one of my favorite things, you know, going through COVID and a lot of people were not socializing, is the community rooms that we have in our Years Ahead clinics. We do invite seniors in the community, our patients, to utilize them for small gatherings. And then when we have our programs, it's really great to see people connecting. After the class is over, they've made a new friend, exchanged numbers, and they're being social again, and that's really good to see.
So they can probably sit there and maybe play cards, play
have
checkers,
coffee.
and just spend time with others.
Absolutely, we encourage that.
This show is called Flowers While You're Living, okay? And since you're here to represent the organization, Kettering Health Years Ahead, I'd like to give you these flowers for your organization to have, because people have so much to give and so much to offer, and that's my way of giving back, so that people will know what it is that your organization does. So I want to give you those flowers.
Well, thank you so much. That is so kind.
You're welcome. You're welcome. And since we're coming to a close, I always like to leave you with this. Don't pray on the problem, pray on the solution. Till next time, I'm Cheryl Thomas with Flowers While You're Living.